We're going to go straight on to a contribution from Irene Beautyman from the Improvement Service, another one of the core partners behind the Place Standard tool. She's going to give us an overview of place-based working, the place principle, and how you focus on outcomes. So Irene, over to you. And as I said, questions in the chats and we can pick some up at the end.
Thank you. I'm doing that thing where I can't multitask and get my slideshow up at the same time. Hold on. So my job at the moment, and I think it is interesting to be able to give background here, is from 30 years of working in local government and now working for the Improvement Service and Public Health Scotland. So the Improvement Service is very much in a role of supporting local government on delivering their contribution to national outcomes, place-based approaches and so on. If you can't see my presentation, let me know, but if you can, that's fine, I'll keep going.
I can see it.
Great.
Hopefully everyone else
and obviously for Public Health Scotland, they sit with the as one of the organisations delivering on Scotland's public health priorities, but the remit sits very strongly in local government to deliver the actual things that can deal with those kind of aspects that Sandy was just talking about, those social determinants of health. So my role is that cross between, we've got all the expertise and data in Public Health Scotland, and then we've got local government there able to have the remit to do something about it, and linking those two up. So what I want to do today is give a bit of context of where the Place Standard tool can be used, given where we are in Scotland at the moment coming out of a pandemic, and the importance being put on place, and then where it sits as that transfer down into the importance of people and their needs and their aspirations, and feeding that back up into culture change, policy change, whatever change we're going to need to address as we come out of the pandemic. Sandy covered a bit about place there. I would add, when we're talking about place-based approaches in Scotland, it's the fact that every place is different, so we need to take a different approach in every place, be that a street outside your window, a town or a country. They're all slightly different, but they have three key elements to them. They'll always have that physical bit, the planet, the town, the pavement, the field. They'll always have the people, the different cultures, the different groups of people, those protected characteristics of people, and those suffering and not suffering from inequalities. And they're always in a place will be the economic side, the work that people are doing, the investment that we all put into the roof over our heads, whether we've bought it, we're renting it, we're borrowing it, and the investment into the pavement outside when we walk out, and all the organisations that invest in an area as well. And all three of those interact in every place. That is the basis of place-based approaches, is to be thinking about the fact that we have all three of those and that they interact. This quote I always use to give the best example of that, whereby obesity, inactivity, depression and loss of community has not happened to us by some fluke. Rather, we legislated, subsidised and planned it. We didn't do it deliberately. We didn't intend to cause all of those sufferings in the first half of that statement. We went in well-intentioned to do an intervention in one of those elements of a place, and it had unintended consequences prevalently on people. And that place-based approaches is thinking about the interventions that we go into, essentially thinking about people and having a positive impact, but we're not having a full think about the impact on other parts and other people and other areas of a community, because there is no one community in any place. This captures it in an image. We're busy doing our own little bits of prevention and we're not thinking about the whole thing. The elephant could be dropping dead on its feet and we're still holding on to the tail, getting on with what we think is the right thing to be doing. So there's nothing new about place-based approaches, and we go back 10 years now. We've got the Christie Commission, it's 10 years on. Scottish Government are very strong about it's as relevant now as it ever was, and I think the Place Standard tool sits really well as a way of moving forward and continuing to apply the principles that were the recommendations by the Christie Commission. Obviously there's that link with people, that's an obvious one. It's a tool to go and speak to people, as Sandy was explaining. But there's The prevention aspect there is huge, because the elements that it talks about are those things that, as Sandy was saying, that we need to shape differently in a place to prevent people from becoming ill in the first place. Likewise, it also can prevent the carbon emissions that are damaging our planet in the first place as well. That's very much a preventative tool. It's thinking about not how do we treat things that are already happening and solve the problem. Let's get upstream here and think about how we prevent having to treat it in the first place. Given the range of questions that it talks about, then even if you're thinking about a local government setting, you have to work in partnership across different parts of council if you're actually going to address all of those areas and take something forward having used the tool. Otherwise, it's just a tool, gives you a pretty picture. There has to be a process here for working with those tools and taking that and bridging what a community are saying back up into a change, a system change, a policy change, or whatever in whatever organisations are influencing that place. And then there's the performance aspect that Sandy was referring to. You can go back 3 years later and talk to a community again and see what's changed. And hopefully it will. And if it hasn't, there's something wrong there, and there's an obvious link that you can see there's something wrong, because the reasons and the conversation, the rich conversations, will be saying the same thing. I've never known a consultation tool to be able to do that before. And there's an important aspect to highlight where we are coming out of COVID. The Social Renewal Advisory Board was set up to look at how do we come out of COVID and think about the people of Scotland. The report is called If Not Now, When? And they are very clear that all of the recommendations sit within thinking about place and all of these aspects of place, and that we still very strongly need to be thinking about the principles of the Christie Commission. So I think the tool has a really strong role as we move forward, and we are waiting on Scottish Government's fuller response to that after the elections today, but they've certainly been very supportive of wanting to take on board those recommendations. So it's a tool that's sitting there and ready to use as we move forward. It's a tool, again, that is sitting and ready to use as we apply the place principle that Sandy's already covered. It's been in place now, and it was really introduced to say, look, the Christie Commission is still important, and here's a reminder, we need to be working together and with communities, and that emphasis on communities stays strong, and I think that's where the place standard tool particularly helps. This image here is about having spent years in councils. I know I worked in the spatial planning aspect of a council, and now and then, you know, we'd sit there as a tin of new potatoes, and we might mix with transport, because that seemed good. We could new potatoes and tomatoes, that works. But did we go and speak to education? Well, that was peach halves. We weren't going to open up that tin and talk to them, because we didn't really understand how that could work together. The place standard tool, and what it does is it starts that conversation back into organisations to open up those tins, to get everybody involved in actually looking at what are the conversations of what a community is thinking about an area and how we can join together to address them. It is a person-centred approach in how we can use it. So where are we right now within Scotland? So prior to COVID hitting, we already had national outcomes. The tool is very good for delivering on that ask to be thinking about communities and to deliver on those outcomes. We also had a net zero emission targets changing every part of our lives, and so many of the aspects of it can also feed around those net zero emission targets as well. But then we had COVID that hit, which is, you know, we talk about prevention. It's been the biggest experience of a lifetime for most of us of prevention. Stay at home to prevent getting ill. I hope we can keep this idea of preventing ourselves from getting ill and carry it forward. It's certainly coming through as one example that I'll give you for how the place standard can be used. In the programme for government last year, Nicola Sturgeon in her introduction was really clear about how lockdown has improved lives for certain people, that they have more access and time and in their locality to use their active travel, to exercise, to use local shops. And all of that is shaped into this term, a 20-minute neighbourhood, where it enables people to live better, healthier lives, and at the same time is supporting our net zero ambitions. So there's an ambition there to keep this local living as something that we continue post-COVID and as part of our recovery from COVID. 20-minute neighbourhoods are a place-based approach. They are thinking about the neighbourhood in the round. This is an example on the left-hand side of what Melbourne are doing on a 20-minute neighbourhood approach, and they list all the aspects that they see as being important to deliver a 20-minute neighbourhood. You'll notice the main thing there is it isn't really about how far you can walk in 20 minutes, it's about living locally. It's just a fantastic term that people have caught into. But if you look at the actual topics that are the areas that they're saying, these are the features that you need to deliver local living that enables health of our people and our planet, then they map across really well with all of the areas that we are going to be having a conversation around with communities if we use the police standard tool. So looking at those place standard tool questions and looking at the fact that we have a 20-minute neighbourhood ambition and ambition for more local living, and for thinking about how does a place actually impact on the health and well-being of people. The place and wellbeing outcomes have been developed by a consortium, a collaborative group of public health, Director of Public Health Scotland, COSLA, let me think now, heads of planning, a whole group of organisations came together and thought, you know, we need to really identify what are the things about a place that we need to deliver upon if we're actually going to turn around the horrific, really, health inequalities in Scotland. We have the worst health inequalities in the whole of Western Europe. The worst, the UK is the worst, and then we're the worst within the UK, and Sandy's highlighted those already. And what we pulled upon about what are the outcomes we want to achieve are really the outcomes that sit behind the questions that are in that place standard tool. They map across the same, but it's actually about we need to achieve better active travel for everybody who's walking, wheeling, cycling, that we have a better standard of that we achieve better upward use of public transport that fits with the upward hierarchy in the transport strategy. So there's a set of outcomes there being set out for these are the things that we need to deliver in the round in order to help our people to thrive and have successful places. We describe places as if they can be successful on their own. It's how people interact with them that makes them successful. Thus, people are right at the heart of it. And that's not just a by chance image of people. That is representing the fact that we have varying groups of people, and we need to consider all of them when we're using the place standard tool and when we're thinking about delivering place-based approaches and the place and well-being outcomes as well. Also, 20-minute neighbourhoods, the place principle, looking at our town centres coming out of COVID, all of these areas that focus in on place. We need to think about the different population groups. Straight across, a very quick mapping there I won't spend a lot of time on because you're very welcome to these slides afterwards, is moving around. That's the very first theme in the place standard tool, and it's about the behaviour change that if we introduce interventions that we can be thinking about how does it impact on behaviour change. Well, we can improve walking and cycling infrastructure. That will mean that there's more physical activity, more social engagement. It actually impacts on all of the public health priorities, and it actually impacts on a consistent set of health outcomes, reducing the kinds of diseases that have moved on now from those that Sandy was highlighting. They were the ones that were caught because we lived too closely together in slums. The diseases we've got now are less likely, particularly when you get to mental well-being, to be the ones that you can go into hospital and get a cure for. A lot of them, the answer to them lies in preventing them happening in the first place and the environments that we live in. So just to close, a little bit about the local work that I've been doing, certainly using the place standard tool themes, those place and wellbeing outcomes, around looking at a small site in Ardrossan, but it was really saying, how is this site contributing to health and wellbeing? How is it contributing to our national outcomes? Of the whole town of Ardrossan when you're looking at putting in a community campus and a school. And we took it through an assessment of the place and wellbeing outcomes. We took it through an assessment of the national outcomes. And we also, very, very importantly, assessed each aspect of that place and what was being proposed for that new development against how would it impact on the different people that could be using that place and lived in that town. So we we've called these rapid scoping assessments, but the document itself, the cover there, it's on the Improvement Service website under Place Programme. And if you want a little bit more of detail of how you can take the Place Standard tool, so what a community is telling you, and then take it into the working of a council and have a council officer, so that these assessments were done with council officers and Public Health Scotland experts, sitting down and having a conversation for 3 hours, long conversation, but it captures in one moment exactly what could be done to improve on a place in order to take account of what people think, what experts who are working in the area think, and pull it all together into a place-based approach. As we move forward then, as I said, I was referring to that if not now, when social renewal advisory report. There's a future here when we come to place-based approaches as we come out of COVID, and we look to how we have, whether we call it a new normal or simply recovering from what we've all gone through. And I think there's a really big role in this for CLD. And I pull out that particular paragraph from the Standards Council description. And for me, particularly in the roles of CLD, when you look at the Place Standard tool, it's about that enabling you to build community capacity by having a conversation in the round about a place and about prevention, but it needs then a partnership approach up in order to ensure that what comes from the community can actually be addressed across different parts of councils and different organisations. So it gets that conversation going. It is just a tool though. There's a process that has to sit behind that takes those results and does the partnership working and reviews performance and gives things a go. An example is what I'm working on myself at the moment is a Shaping Places for Wellbeing programme that is just being worked up at the moment, where we will be looking at working with about 4 sites across Scotland to overall improve Scotland's wellbeing, reduce health inequality and improve at the same time the health of our planet, because we can do both. We shouldn't be doing one or the other. And I list there all the different aspects, all the national ambitions that we'll be feeding into. And the overall desire there is that places and lives have been improved through work with communities, collaboration across sectors and embedded system change around the delivery of those place and wellbeing outcomes. Now, when we go in to do this work, and there are many other organisations going in to do likewise work across Scotland as we come over as we get our new Scottish Government in the next few days, the role of SLD in that work with communities and the role of the Place Standard tool as a means of working with those communities will be at the fore. For ourselves, we have 2 key approaches, linking health and local government, but linking into a citizen-centred approach. And we'll be using the tool to do that. And we'll be looking specifically at sites for inequality, town centres as we come out of COVID, and those in areas of inequality may well suffer more than those that have got a well-heeled population who will be able to work from home and perhaps help their town centre. And we'll be looking for a geographic mix of sites of what we're doing. But that's really just one example. There are a lot of organisations stepping up now and being funded in order to do more around this. And I think there's a role for CLD and for the Place Standard tool in achieving that. Thanks very much. That's the Improvement Service website. As I say, if you have a look under the Place programme, there's a lot more information on the scoping sessions that we've done. Thank you.
Thank you, Irene, for that inspiring as ever and eloquent overview of the transformatory power of place-based working and that kind of stirring call to action about the relevance of the Place Standard to building community.